Morning, colleagues. Welcome to this Behavioural Research UK webinar. We're really pleased that you've been able to join us today and to make the time to attend. My name is Linda Bauld. I'm the co-director of BR UK and also Chief Social Policy Advisor at the Scottish Government. I'm joined today by three colleagues from BR UK, Ashley Gould, who's a Programme Director in the Behavioural Science Unit at Public Health Wales, Richard Amlot, who's Deputy Director of Behavioural Science and Insights in the UK Health Security Agency, and Ben Cavanagh, who's Analytical Unit Head in DG Strategy and External Affairs in Scottish Government. So you're going to be hearing from all of us today, and I'll just begin the webinar just by setting out the outline for the session. So I'll say a few words just in terms of setting the scene on evidence-based or evidence-informed policy, and I can tell you a little bit about the terms, so most of you will be familiar with those. And then I'll hand over to Ash, who's going to go through policy dynamics and behavioural science, concepts and frameworks. We'll then pause for some questions to Ashley and I, if colleagues have any. And then I'll hand over to Richard, who's going to share insights and experience from the UK Health Security Agency, and then Ben, who will give you some examples and tell you what we are doing in Scottish Government. And then we'll have a slightly longer Q&A before we close, and we're estimating we'll finish by 12:15. So if you have a question for us as you're listening to the webinar, please pop that in the Q&A box that you'll see at the bottom of your screen, indicating which speaker it's for. If it's for everybody, that's fine. And if you're listening to the questions, or you're looking at the questions, pardon me, that other people have put in the Q&A, and you think any of them are particularly relevant that you'd like to hear answered, you can upvote them. There's an upvote function, and that will ensure that those go to the top of the list, and I can make sure that I see them and ask them. So I'm going to move on now just to some introductory remarks. First of all, say a little bit about evidence-based policy and policy making. Actually, we've run through the outline, so I'll move on to the next slide now. So what is evidence-based policy? So this is, if you look at the literature, it's been argued this is actually as old as the state. So governments have always been interested in, or decision makers have always been interested in using information to inform decision making. That's nothing new. But it certainly, I think, became more prominent through evidence-based medicine in the early 1900s. And then in the 80s and 90s, in particular, in governments across the world, you'll see there was a greater emphasis on this. The UK government's 1999 modernising government is often pointed to as a white paper that had a lot of that kind of content. There's a debate about whether evidence-based policy making is an accurate term. People often use the term instead evidence-informed policymaking, where different types of evidence are considered, but they're not the only factor driving the policy. I think that's fair enough. And the effectiveness of evidence-based policy really depends on the presence of three things at least: quality data, proficient analytical skills, and they can be from within or outside of government, and also political support for the use of scientific information. And I think those three things, in my experience, are quite important. You might have questions about them as you listen to the speakers. So using evidence and analysis in policy making is not always straightforward. And all of you who've worked with governments or with different organizations around the world will know that. There's lots of pressures in the decision-making process, and politicians in particular are dealing with lots of competing priorities and lots of requests from different stakeholders. But policymakers, and certainly in their training, should strive to provide rounded advice that reflects existing evidence, and that will help ministers make informed decisions. So that's particularly the case for civil servants. And considering using the value of evidence and analysis at each stage of the policy development process really helps illustrate that, and I'll take you through that briefly. Next slide. So what happens if it's not evidence-based? And those of us working in different parts of government have seen this, and the public sees it as well. So if ideas are not tested before delivery, an intervention risks failing, really not delivering the intended outcome. So let me give you an example. I'm going to give you some examples as we go through this. There's a big debate about heat in buildings at the moment. We want to make our houses more sustainable, more energy efficient, warmer, which has health outcomes. But lots of the solutions that governments have provided, heat pumps and other things, there are multiple barriers to implementing those, cost being a major one. So unless everything is tested robustly and there are mechanisms that make it affordable and acceptable to people, it's difficult. Policymakers can often be given a solution by decision makers and asked to implement it. But the question is it going to meet the needs of the people who will use the policy or the service? And here behavioural research becomes central to this question. And you'll hear some examples of that. So has it been tried in another country or jurisdiction? Has it worked or not? Has it caused problems, for example, to disadvantaged groups? And how might it increase or reduce inequalities? And what we see is if decisions involve working with analysts and information from the beginning of the policy process, some of those risks can be reduced. And also those unintended outcomes need to be considered throughout policy development through, really importantly, impact assessments, which in government we have to do on a statutory basis, some of them, but often they're done in a very rushed way. And that really undermines, I think, sometimes the policy and the use of evidence. Next slide. So why is it important at each stage of the policy cycle? So this is the diagram that some of you will be familiar with, this idealized way of thinking about policy, right from beginning to have a problem and the information about that through to evaluation and feedback. It doesn't occur in this way. I see this in practice, but in an ideal world it would. I'm just going to use a simple example of a policy in Scotland to illustrate this. We have high levels of child poverty in the UK, and that includes in Scotland, and addressing child poverty has been a priority for our ministers. So we have something called the Scottish Child Payment, which provides £25 to children up to the age of 16 if their families are eligible for universal credit, a UK government benefit. The rationale for that policy was that we needed to put more money in the pockets of the poorest families, and this additional payment would make a difference, and there was data to support that. The objective was to contribute to achieving our statutory targets to reduce child poverty in Scotland, and the appraisal that happened around that policy when it was set up was what amount should the payment be, and it's changed through time, who should be eligible, and really importantly, what will the delivery mechanism be? Should, for example, it be distributed via local councils? And in the end, the decision was that it was easier to connect it to a UK government benefit through eligibility and administer it through our devolved social security agency, Social Security Scotland. When it was implemented, there was a lot of monitoring of how that's going. The data are regularly reported. And then the evaluation has been not only looking at the outcomes for families, but also behaviourally, how is it received? So if it's attached to universal credit and there's a cliff edge, if people are no longer eligible for that, will it have an impact on labour market involvement, on the employment perhaps that families or parents take up? And then that's continually being reviewed. So that's evidence throughout the policy cycle. It's probably a pretty good example. It doesn't always happen that way. So just one more slide or two more slides from me. Next slide. So you can see this is a different way of thinking about how evidence feeds into policy, and we're going to come on to show behavioural examples of this. So setting the agenda, developing the policy, so from a behavioural perspective, who's going to be affected, how might they be affected? In terms of adoption, will the group that you're aiming to benefit from the policy actually receive it and receive it in the way that's intended? How is it implemented? Is it implemented in the same way around the country? What's the behaviour of the delivery agencies who are tasked with doing that? Evaluation, as I just mentioned in the last example, but behaviourally evaluation would be looking at what are the behavioural outcomes if we're, for example, aiming to achieve behaviour change around environment or sustainability behaviours, driving, health and well-being, etc. And then maintenance, does it actually deliver consistency over time for the behaviours and the groups that you're targeting? And how do you make sure that you're looking at continuous improvement? So behavioural research and behavioural evidence, in the same way as that social security example I just showed you, has relevance throughout the policy process. Next slide. So I'm going to hand over now to Ashley Gould from Public Health Wales, who will go into this in a bit more detail. Thank you.
Thanks very much, Linda, and morning all. Thanks for the opportunity to share some thoughts with you. So I'm going to introduce one concept actually, and then in some ways cycle back to the content that Linda's shared with us around some frameworks. So this is the concept to start with then. So policy development happens, policy happens. It's happening at the moment, it'll happen today, and it'll happen continuously going forward. So the system, public sector system generally, full of good people working to, for example, prevent disease, help us with mitigation and adaptation behaviours and approaches to the climate crisis, trying to sustain and grow economic growth, and then modernise education and optimise outcomes in there, etc., etc., etc. And that policy development process will happen at pace, under pressure, and with all good intent. So there's no criticism around this. So policy is the answer, as Linda's highlighted. It is the way that society approaches tackling some of those challenges and making collective progress. But how good are we at navigating and accounting for the complexity of behaviour in that process so that the policy works? It does what we want it to do. And the behaviour in that respect is often about the public, but it's not exclusively about the public. It can be about practitioners, it can be about the doctors and the teachers. It can be about employees in other senses as well. So all humans and the things that they do. And how good are we at navigating and accounting for that complexity? So a couple of early questions in response to policy is the answer. Are there human behaviours on the policy realisation pathway? Or are we just hoping that it's going to work if everybody does exactly as they're told and instructed in the policy? Maybe behaviour change is the ultimate goal of the policy or the service. And if that's the case, these questions apply, I think, as Linda has highlighted. Who exactly do we want to do what exactly? And why would they? What's their intrinsic or extrinsic motivation to undertake that action? And then why not? What's in the way for them? So those are questions that we think behavioural science can answer. So behavioural science and research can help us get what we aim for more often from our policy. And that's the concept of the behavioural dividend. That's the extra that can be released. And that extra can be in terms of efficiency or more effectiveness or better reach of your policy. It can be about, if we really focus on the who question, it can focus on redressing equity. And it can be around increased timeliness and impact from policy. So there's a concept of the behavioural dividend. Next slide, please. So I'll now talk about a couple of frameworks that really put a behavioural lens over the generic process that Linda's introduced us to. This first one is from OECD. It was released in 2019. It's called the Basic Toolkit. So, and you can see from the graphic on the left-hand side here, it follows the steps that Linda's taken us through, starting at, say, 1 o'clock with the agenda set in, moving through drafting the rule, constructing the policy, implementation, monitoring, and enforcement in the broadest sense. The team that put this together looked at 150 use cases, and the vast majority of those showed late-stage use of behavioural science is the norm. So it leans towards the implementation and compliance side of this graphic. Behaviour is often only considered after the analysis has been done, the issue has been identified in the analysis undertaken. And then that leans towards the use of behavioural science in experimentation, in trialling and evaluation. The left-hand side again of this graphic was the findings as this team put this guidance together. And that's manifested through behavioural tweaks. So more salience of information or just changing to the right default is all that it can do when it's applied, behavioural science can do when it's applied late on in the policy process. So a sort of 5 out of 10 really. Behavioural research can add so much more the earlier it's used in the policy development and implementation cycle. So we can maximise the dividend, that behavioural dividend, the earlier we use it. And this guidance calls for a move from those technocratic tweaks to systematic change in processes and using behavioural science more in the ex-ante appraisal space, so as early as possible. I'm picking up what Linda's talked about. They mention in this guidance, behavioural science can't be really effectively applied without understanding the delivery mechanisms and the social and environmental contexts that policy is dropping into, if you like. They use a really interesting approach, or advocate for it, in the guidance. It's around decomposition, strange word, but about unpacking the policy problem into behavioural components, describe them as behaviours, and advocate the use of a hierarchical branching tree model to connect general policy with concrete behaviours and the segments of the population that you want those behaviours ideally seen in. So a thought around that is that this is an area for a potential collaborative endeavour or endeavours between policy researchers and policy policy developers and behavioural researchers. Next slide, please. So the next framework that I want to chat about is more recent, published just a couple of months back by a subcommittee of the National Science and Technology Council in the USA. So that's a body that advises federal government on the development of policy. And they've issued a blueprint for using behavioral science in advancing evidence-based policy. So confirmation bias aside, I think this is a really good document and a good summary and framing of it in this first bullet that I've included. So they recognize that human behavior is a key component for every major challenge that we've got, and the effective integration of it means that programs simply can't achieve their intended outcome without it. They describe it in terms of the processes that influence outcomes and decisions, which is a great sort of scope and boundary around it, and an essential role in every part of that policy process, again, from conceptualization through to evaluation. And they talk slightly wider than policies in this guide around interventions and programs, so a broader scope of influence for behavioral science. And this bottom bullet then is taken from their executive summary, a very neat example where they talk about the introduction of the elevated third brake light on cars, the way that behavioral and social research contributed to that, and the numbers at the bottom painting a stark story of a tiny addition to the average price of cars, preventing large numbers of injuries and costs. So the next slide shows us again a very similar framework. The next slide then, please, on the cycle, starting at 11 o'clock with this one, if you like. It's very similar to the process that Linda's talked about, but this has been adapted for the hooks, or includes the hooks where behavioral and social research can add value then. So starting at the top there with that, as I say, 11 o'clock, not necessarily just about where there's a policy problem or a failure, but behavioral science can add so much more to strengthen and scale and broaden policies that have got some traction already. So that's an interesting framing. It's slightly different. Step 2 is around considering the insight. So how do we do that early and in a balanced way? So thinking about the cognitive, the psychological, the social, and the environmental influences of behavior. They advocate the identification of expertise from behavioral research to inject at that first step. And they call for the some consideration of the consequences of skipping this thought. Just don't worry and just don't think about behaviors. Let's push our policy in. So thinking around the consequences of that is a way of, system 2 thinking, slowing the thinking down and trying to understand what would happen if we miss this out of our policy development process. Third step, core around the evidence and best practice, so the blending of social, behavioral, and data sciences, consideration of the constraints, particularly around equity, and a direct quote from this framework: engage behavioral science researchers at that point in terms of building the evidence and putting that part of the jigsaw into the process. Step 4 is around actionable steps and policy mechanisms. So using behavioral science to move from discovery and understanding that into implementation, mapping the actionable steps onto what they call the federal levers, but the levers of change that are available to the policy maker. So using behavioral science to do that mapping and that transition. And in terms of implementation and dissemination, as Linda's talked about, accounting for the context of the policies going into from a behavioral perspective, using implementation in terms of communications for awareness, acceptance, and trust. And then in terms of the final step, reflecting and revising, so ensuring effectiveness, using behavioral science to think about the behavioral outcomes, and incorporating new evidence, evaluating, using behavioral science again, and driving thoughtful inquiry through the use of behavioral science. So that's a really quick run through of that framework. And then this slide has just got some bullets that the blueprint pulls together, a set of recommendations or action areas. So they talk about a call for an investment in that dynamic and durable evidence ecosystem. Again, the behavioral science piece of the jigsaw being properly located, strengthening the connection between those players in the policy development implementation space. A set of opportunity, technical opportunity areas on bullet 3. So buy-in for senior leadership around the use of behavioural science, reducing the sludge, the administrative burden for using behavioural science, improving data equity and access, and that blending. And more blending on bullet 4 then. So thinking about the blend between policymakers and behavioural science and behavioural researchers, and that interagency effort, but thinking about it in terms of a behavioural science trained workforce in policy, not experts, but knowing when to push the button, when to pick up the phone, when to engage expertise is really important and identified as an enabler in here. And then a mandate for using strategies through funding, so enablement through funding. And the next slide then, please, which is my final one. So I've taken some, this is just some reality, if you like. I've looked at the work from Inga, Charlotte and colleagues that are in RIVM, which is the Dutch Public Health Institute. They've just done some research, mixed methods, looking at reviewing guidance that was put out through the pandemic. They've done some interviews in policy with some policymakers in the Dutch system and some simulation exercises, and their findings are these 4, which I think are really opposite to the frameworks that I've just talked through. So there are differences in terms of the effort and obligation to use different sources in the policy cycle. So some are classified as need to have and some are nice to have. And I wonder where behavioural research is in that. I think it's in the nice to have category at the moment. It's something that we want to move towards need to have. My interpretation of this is it's easier to read speed limits and novel advisory, so everyone can tell what the 30 sign means. You'd need some interpretation and support for that other graphic with the vehicle and the yellow cloud over the top of it. So this is true in terms of evidence into the policy process as well. Harder numbers around epidemiology, vaccine uptake rates, GDP growth. Hard numbers, easier to interpret than perhaps harder data around behavioural determinants and behavioural influences. So that's something for us to consider. And maybe we use things like the probability yardstick, the graphic on the right at the bottom, that's used quite frequently in government circles. But we could use that in terms of behavioural informed advice to put some bounds on it and make it easier to interpret. Perhaps this is common sense, but the closer the advice giver is to the policy process, the higher the potential effectiveness of that advice. So that helps with timeliness, our agility and responsive framing of behavioural advice in the policy development process. And very much as Linda's talked about, the blending of science and the behavioural science in this case, and the art of policy influence and policy development. The closer we are to that, the more likely the effectiveness of the advice. And then finally, we do this with the public in terms of, or when we're putting interventions into place, always integrate the rationale. We should do that in terms of the behavioural advice as well, and that can help overcome blind spots and clarify the underlying value of the behavioural research and the dimensions that we've covered in the advice. I think that's me done, Linda.
Thank you very much, Ashley. And we do have one question for you in the chat, which, sorry if I can turn my camera on, I will pose to you. And if Richard and Ben want to chip in on this, and I'll maybe also ask one of the questions that was posed to us in advance of the webinar. We received some by email, and then I'll move on to introduce Richard. So you can see that question in the Q&A, Ashley. What if I wanted to review policy and guidance? So this is a post after policy and guidance has been developed. How can I use behavioural science and frameworks post policy development to look at effectiveness? I don't know whether you've got any examples from Public Health Wales where you may be brought in to review and strengthen something that's already happening, where you can use behavioural research approaches to do that.
Yeah, I think in terms of that American cycle and that process that we can strengthen, broaden or scale interventions by using behavioural science is very true. We're using it in terms of lots of work that we're doing at the moment with screening services, so cancer screening services. So they are in place, they are running. We send out over 1 million letters to invite people to cancer screening every year. The attendance rates are not bad, but they don't have to be bad to be better. So we can use behavioural science to review those, particularly invite letters then. So we are going through a process of checking the letters, if you like, against a recognised behavioural framework, the COM-B framework. So have people got the capability, the understanding, the knowledge? Have they got the opportunity? Do they think it's normal for a person like them to do the thing that we're asking them to do in the letter? Can they get to the screening centre, or can they send the sample back that we want? And then motivationally as well, we're assessing whether people have got the, they think it's worth anything, the belief in the consequences of doing it. So we can put those frameworks over things that are already running. It's not completed, it's an ongoing process, but we can add value to them, and then we need to test the adjustments that we make to those changes. And we're doing that, as I say, across cancer screening programs in Wales and where others are doing the same. So yes, you can use it in that space for sure.
Thank you, Ashley. Anyone else want to add on that? Richard?
I've got, sorry, I'll just come in there. I've got an example in a little bit later on, actually, about where it is being used in that context. So where an intervention's been running for a while, there's questions about if it is pulling at the right drivers, how's it being received and understood? So as a way into evaluation and monitoring design and improvement. So I can maybe talk about that a little bit later on. That's okay.
Thanks, Ben. Just one comment from me on that. If there's any students who've joined the call today, you can also use behavioural models, theories and frameworks to do desk-based research on policy documents. So you can look at a programme for government, that's perhaps not the best example, a white paper or other report that's produced, and just see if behaviour is the focus of some of the policy intent, then how is that described? And what are the levers that are going to be used? Have they adequately considered behavioural elements? So that's quite an interesting approach as well. Okay, let me just check. I think that's the only question at the moment. So I think I'll save the question we received in advance till the end, when I know we'll have lots to discuss. So I'm going to hand over now to who's going to look at behavioural science for policy at pace.
Excellent, thank you. So hello everybody, my name is Richard. I'm a Deputy Director in the Science Group of the UK Health Security Agency, and I lead the organisation's Behavioural Science and Insights Unit. So we're a team that's existed in the health protection functions of Public Health England, working through the COVID-19 pandemic and now in UK HSA. And so for some time our focus has been on the application of evidence and insights from the social and behavioural sciences to health protection and public health emergencies. So the social and behavioural sciences are critical to the ambitions of UK HSA set out in its strategies. So for example, we need to first understand and describe human behaviour in response to health risks and hazards, so that our policy and plans are informed by evidence and not conjecture, assumptions and myths. And to do that, we need to generate new evidence and insight with our populations and communities. And our behavioural scientists and our insight team work on projects designed to shed light on the experiences of communities facing chronic or novel health threats, and particularly health inequities. Behavioural science approaches are particularly good at helping us to understand the barriers and facilitators to the uptake of protective behaviours and adherence to our public health guidance and advice. And most importantly, by systematically characterising the range of factors that can affect a behaviour and health protection incidents, we can design and optimise our public health interventions to increase the chances of better health outcomes. So next slide, please. So as I suspect with many people on the webinar, our team worked through the COVID-19 pandemic. We were working in support of Public Health England's incident response. We were working in partnership with other incident response cells and teams within the organisation, and working collaboratively with colleagues from other government departments. We were a team embedded in the Emergency Response Department of Public Health England, which meant that prior to the pandemic, alongside our day jobs, we also played a role in on-call rotas, supporting the delivery of preparedness exercises and training, and working in support of a number of previous major incidents such as swine flu, the Ebola outbreak in West Africa, the Novichok attack in Salisbury, and more. And these experiences helped us to understand how PHE and now UK HSA responds to major incidents, and we've developed our role in support of public health emergency response over the years. So next slide, please. So this slide just sets out some of the ways in which our team contributed to the national, regional and local response to the pandemic. However, what I wanted to do was to tell you about an early experience in the pandemic response towards the end of the first national lockdown in June 2020, which I hope will set the scene for some reflections on working with policy at pace. Excuse me. So on a Friday evening in June 2020, I received a call from one of our senior public health medics. Okay. So I received that call and I couldn't think of something fast enough as to what I was doing at the weekend. And he said, right, you're coming with us to Leicester. So later that evening, I drove from Wiltshire up to Leicester to join a small rapid investigation team for the weekend, tasked with helping to understand what might explain why COVID case rates were staying high in Leicester whilst coming down across the country associated with the first lockdown. So we spent the weekend working alongside health protection and public health teams, visiting local areas, speaking to businesses and community leaders, and exploring the COVID infrastructure that was in place, including local communications, testing sites, and the implementation of public health guidance. So we learned a lot that weekend. Firstly, it was clear that the local teams had gone to considerable efforts with the time and resources that they had to deploy COVID-19 related messaging and signage, to post updates and information for their communities on their website and via other traditional media, and to engage with the COVID testing offer that was available to be deployed at the time. So beyond those efforts, we noticed some aspects of the response that needed attention. So Leicester is a diverse city, and at the time, almost all materials were in English only. Additionally, once you went beyond the centre of the city, the messaging, information and signage were largely missing. So we spoke to one shop owner from the Southeast Asian community who had gone along to the local branch of Tesco's with his phone, photographed all of the COVID-related signage, and then translated and printed posters on his home computer to put up in his shop. So we also visited a testing site, and at the time, these were often run by the military and had particular logistical requirements that meant that our out-of-town shopping centre car parks were often the most convenient place to site them. So what this meant was that for communities with low car ownership, working shifts in food processing factories, which were the largest employers in the area, simply being able to access these testing sites and have the time in the day to go was not possible. The pandemic was particularly affecting these communities, and we saw no lack of willingness to engage with the response efforts. The challenge was knowing what to do and then having the ability to do it. So hopefully you might have noticed that these examples speak to some of the ways in which we as behavioural scientists approach understanding the context in which behaviour may play a role in determining outcomes. We identified barriers associated with knowledge and skills, opportunity and access, and met engaged and motivated community representatives who we hadn't yet reached with our response efforts. So these and other insights were rapidly fed back and used to inform actions and policy. It was largely in the context of the early Leicester response that we saw so-called hyper-local testing being created, where smaller, more agile testing sites were deployed within communities, along with door-knocking staff who handed out information about the offer to encourage people to attend, and leaflets with more COVID-related information. Within days, guidance was translated into the most commonly spoken languages and published on the local authority's website, and these were iterated through a refreshed and reinvigorated community engagement programme, which was a forerunner of the Community Champions scheme. Local industry and businesses, identified as key community leaders, contributed to increasing testing rates and implementing COVID-safe practices. In time, cases came down. The lockdown in Leicester, which had been extended, was lifted. Next slide, please. So I wanted to use this as an example to segue into some reflections on working with colleagues to shape policy and operational decisions at pace. So if we want to maximise our impact, we'll often need to align our work to the pace, priorities and processes of the teams that we're working with. In fact, fast-paced health protection and outbreak response environments, policy and operational decisions must be made quickly, and we need to be prepared to provide insights that are actionable within these time constraints. There are circumstances where one of the best contributions we can make is to help our colleagues see the world through a behavioural science lens, meaning that our models and frameworks can help generate better questions and new hypotheses concerning the factors that may be affecting behaviours in context and how they're interacting with our policies and interventions. So Thinking about policy challenges from a behavioural perspective can sometimes be the key to reshaping our response in ways that work with and not against those that we're trying to support. We also know that policy teams operate in contexts shaped by political dynamics, budget limitations, and operational urgency. So developing an understanding of those constraints can help us to tailor our contributions so that they're responsive to these pressures and more feasible and realistic. Often in incidents and outbreaks, decisions have to be made under conditions of uncertainty. So as part of the wider provision of scientific advice, we need to help colleagues understand behavioural evidence and confidence so that this can be weighed appropriately alongside other factors. If we want to maximise our impact, we should be willing to get hands-on with the papers and the products that our colleagues produce. Very often, I think a barrier in the adoption of evidence into policy and guidance is research translation. So we should be willing to help our colleagues to identify how these outputs can shape their guidance and policy. In this context, it is important to not forget that our role is one of advisor and not decision maker, but we can align our recommendation in ways that can support the adoption of evidence-based policy. So to that end, as Ash has set out, it's important to understand where you are in the policy cycle. So knowing this can help shape the type of behavioural advice that we offer, prevention and preparedness, real-time adjustments, or post-event feedback. And during business as usual activities, we need to engage with colleagues and work on being present and available upstream in the process. So there can often be a challenge, as has been noted, with late engagement of behavioural expertise when the direction of travel has already largely been set. And it highlights the importance of proactively engaging with the teams you'd like to work with, understanding where and how we might best contribute. And this helps to position ourselves when a new incident is declared, so that we're able to make the most effective contribution. Okay, next slide. Okay, so the need to respond to public health emergencies is not likely to let up anytime soon. And the ongoing Mpox public health emergency of international concern, the Marburg outbreak in Rwanda, outbreaks of H5N1 avian influenza in livestock in the US, all highlight the importance of having a standing, agile, responsive health protection capability for the UK and to work with international partners. There are behavioural aspects to every public health emergency, and the largest can have impacts across all domains of government and all areas of public life, meaning that our behavioural science and behavioural insights teams should have a role to play in helping to feed in evidence-based advice in their areas of responsibility. But it doesn't start in response. It starts in engagement in all stages of what's called the emergency planning cycle. I think one of the areas where behavioural and social scientists can and have been having some of the most significant impact is supporting the engagement of communities in emergency preparedness and response activities, bringing methodological expertise and subject matter expertise to support co-production efforts. It's not always been the case that the public have been an active contributor to our emergency preparedness activities. And these engagements are only expanding, and the appetite for communicating about risks and hazards and willingness to promote dialogue is increasing. And a relevant illustration of that is the recently published Prepare website, which I would definitely recommend having a look and asking yourself, are you prepared for emergencies too? So I think that's all from me. Thanks for listening, and apologies for the break in service. And I think I'm now passing over to Ben.
Thanks, Richard. Over to Ben.
Thank you, and hello everybody. It's nice to be here. I'm Ben Cavanagh from the Scottish Government, and I work in Central Analysis Division here. So our role is really to work in the centre of government to build capacity of evidence and research across policy processes and policy areas. So for a bit of background context, I don't know how much everyone knows about how devolution works, but since 1999, the Scottish Government has had responsibility for these outcomes that are on the slide at the moment. So some big, chunky, complex areas of societal and economic well-being there. If you're looking across, we've got health and education, housing, transport, culture, lots of environmental stuff as well. And we've got an annual budget of just under 60 billion in 2020, 24-25. So we're large policymaking organisation, and within that we've got around about 600 analysts working within that process, and that's people from social science disciplines, and that we tend to be grouped under some of the main headings as economists, social researchers, statisticians, and operational researchers. Typically, the role of analysts in that process is to help understand the nature of policy problems and the context and the background world, and to help develop the best solutions and interventions that could be made, and then also to monitor and evaluate those activities just to check that everything's on track, going well, diagnose issues, and to tweak delivery activity. So that's the analysts, but clearly there's lots of other people working in behavioural science, and 3 roles as policy advisors, communications staff, strategy professionals as well. So what I wanted to do today was just give examples from a couple of policy areas that illustrate how policymaking has engaged with evidence from behavioural science to show the dynamics that have prompted that, and then also to offer some thoughts about how we're trying to improve and get better at bringing behavioural science into policy and some of the things that we're doing. So first example I'm going to be talking about is from transport and reducing car use. So on the next slide here, this is an example from colleagues working in Transport Scotland, and we've got an aim to achieve a 20% reduction in car trips, and that's as measured by kilometres driven in cars by 2030. So that's because transport accounts for around just under 30% of Scotland's greenhouse gas emissions, and cars are a really big chunk of that. So 38% of that is cars. And in 2019, 65% of all journeys were made as car driver or passenger, and that's been going up in the preceding years. So it's going in the wrong direction when we really need to reduce that car mileage if we're going to meet the target. There's also secondary benefits in reducing car journeys, clearly, for improved health and well-being and reduced inequalities and economic opportunities. So that's all part of the mix. The Scotland's climate change plan was published in December 2020, and behaviour change is really presented as being at the heart of that, because technological solutions are important and possible, and we're doing things on that, but it's not enough, and behaviour change is really the key, and that's what needs to be done to reduce the distances that are driven. And clearly it's hard because driving and cars are deeply ingrained, and the reasons people make car journeys is very varied, and there's lots of fairness and social justice questions around it as well. People living in rural areas, disabled people, and lots of businesses are much more car dependent than others. So within that plan, behavioural modelling was at the centre, and it was used to identify the factors that were most likely to make a difference given where people live, the infrastructure available, people's attitudes and opinions, and also to ensure that there are within all options this inclusive car reduction alternatives. So on the next slide, this shows the 4 policy themes that came out of that work as objectives to reduce car mileage. So there's some stuff which is policy activity about reducing the need to travel. So that's things like using online options for shopping or working within. That's particularly important in Scotland with a lot of rural and island communities as well. Second, living well locally. So this is around about place making and developing places with good local amenities and services and social infrastructure, and that kind of 20-minute neighborhood concept clearly having an effect on car mileage. There's policy activities and interventions around switching modes, so making walking and cycling and public transport better quality options for people and more accessible. And then finally, combining and sharing car trips in some areas. This can work really well for also particularly for people with disabilities. So the interventions that were planned around that and the different investments that we should roll out were considered in the context of the behaviour change COM-B model of behaviour change, and that's presented in the report, which I can link to. But the policy interventions that come out of this process, it's there's a huge number of things, but it's things about improving digital infrastructure and broadband, greater flexible working policies, safe speed limits, increasing budget for active travel, improving access to bikes for school-aged children. A big one for us in Scotland is free bus travel for under 22-year-olds as well, but then also lots of other things about car sharing and linking journeys together and so on. So this example shows quite an integrated use of behavioural science in a policy area, which is maybe a little bit more novel and out of the ordinary to have something which is as core as this, but it's been brought in because the limits of technological aspects is acknowledged in the plan, and behavioural science there is really brought in as a means to help to understand that challenge and reverse the trend. And also in the context of lots of international work and other agencies and areas that are also facing this same challenge, is kind of the norm within that area of work as well. So I'll just move on to another example on the next slide. This is from Scottish Forestry, who's a public body in Scotland. And this is an example of a discussion we've had recently with colleagues there that's probably at a slightly earlier and more developmental stage. And on the next slide, there's some information about the work they've been doing to maximise the use of woodland areas for a number of years. So there's a lot of evidence about the benefits of woodland access for health and well-being. And there have been programmes that have been running for a number of years. And as you can see on the slide, it's reached a lot of people in the last 14 years. But the question that came to us as analysts from the policy team there was, as they're in an evaluation and monitoring mindset, they're interested in has it had the impact on the aims that they expected by dealing with the behavioural barriers in an efficient and optimal way. So to answer this, we worked with colleagues at BR UK, and BR UK, I don't know if people have heard or are aware, but there is a new service function within BR UK called Ask BR UK. And the idea of this is to match people up who have got questions about behavioural science, about behavioural modelling, with experts and people who have good to position to offer advice about the methodology, but also specific bits of evidence as well. So this was part of the pilot for the Ask BR UK programme, but we worked with the forestry team to specify a question for BR UK about the target behaviours and the drivers of those. And then the academic researcher team worked with the Scottish Forestry to discuss the models and approaches, the benefits, how to structure the question, some advice about how to map the behavioural drivers and areas to look into and the relevant data sets as well. So it used the behaviour change wheel there to explain the method and to help focus the question and to provide insight into the next steps for the team. So from those couple of examples there, the policy prompts for behavioural science to come into the policy process were from where teams realised they needed support and advice because something was complex or new, or there was an opportunity that was presented, and the kind of behavioural science has been pulled in. So on the next slide, I think I've noted some of the possible drivers of where behavioural science and behavioural insight gets typically brought in to a policy question. But as Richard and Ash mentioned before, it's not necessarily always the default, and it's not always necessarily the starting point. And quite often it is in that downstream bit of the policy cycle process. So we're at the moment working on trying to get it a bit more of an upstream bit as well and across, so it's not just pulled in where people have recognized the need, but it's actually just part of default working, because given some of the challenges that we've got and the opportunities, it's got a really strong role to play. So on the next slide, this is from World Health Organization, and a couple of years ago, WHO, they run a community called Behavioural and Cultural Insights for member governments, and UK administrations, the four devolved administrations are part of that, and there are 53 member states, and I think so there's 48 countries or something, but the idea is about improving capacity. So the World Health Organization have got this model of what behavioural science could and should look like within a government, and it's these are the 5 themes of strength. or the 5 kind of domains of where it operates. And countries have been assessing themselves to the extent that they feel that they are strong or have got room for development on some of these areas. So I'll just quickly talk through some of them. First of all, it's about behavioural science being recognised and people being aware of it within government and policy communities. Second, about governments running behavioural science research programs and projects and contracts, so doing research. Third one is about applying it, so using insight from research to service and intervention design policies. Fourth, about financially investing in staff and training and infrastructure. And then fifth, having behavioural science as a core part of strategy plans very explicitly, like in the example that I mentioned earlier. And across member states who responded to the self-assessment last year, most countries were pretty low on there was a 5-score assessment from it scores from 1 to 5, and lots of countries probably in the 1s and 2s, some 3s. Countries were strongest on the behavioural science research programs and some of the behavioural science applications, but that suggested that it was a bit more of a niche and patchy and strong in some areas, but certainly not routine across government. And the idea is that over the next few years, countries are putting in activity to try and improve, and that the idea is that the behavioural science offer within policy making is more mature over the next few years. And I've put a link to that report if anybody would like to see it. So I'll just finish off with a few things that we're doing in Scotland at the moment in order to do that. So the main things that we're doing are around about guidance and expertise and defining it for non-specialists. So we've got a behavioural science toolkit here for Scottish Government staff to use. It's got definitions, some of the key concepts, the benefits, things to think about, but then also how to get started and how to bring people in. So this is about trying to recognise where its role is and trying to push up the I guess understanding and expectation and make it a bit more of a normal thing for us to do. So we've been speaking widely about this with colleagues. The second thing that we're doing on the next slide is about trying to make the most of our internal expertise. And we've got a behavioural insight network within Scottish Government, and this is just a place for sharing and peer support from people on the left-hand side. These are just some of the policy teams in areas that are involved in that, who come along to our meetings and our online community. And on the right-hand side, some of the professions that are involved in it as well. So really trying to have cross-government links, case studies, sharing, people asking questions, and gradually supporting each other. So that's a meeting we have every couple of months on a regular basis, and we've got a Teams group, and that leads to lots of sharing and work and training sessions and things like that. And then finally, the third element that we're focused on is our external network. So things like the engagement research organisations, research companies, universities, and networks across sectors, very important to us. Second, working across UK government, wider government departments, lots of activity and opportunity for us to learn from developments elsewhere. So we're involved in cross UK government work on resilience and emergencies that Richard was talking about earlier on, but also health and climate change work and lots of other things. And then third, also this international bit of work with the World Health Organization Community and Behavioural Cultural Insights, which is really great resource for us to tap into, particularly as a devolved nation. So I will end there, but I'd be happy to take any questions. I'm also interested to hear from anybody who's worked with us or worked with government and how it's kind of seen from different perspectives. But I'll hand back to you. Thanks, Linda.
Thank you very much, Ben. And we'll hand over now to the questions. We've got a few questions in the Q&A box. I noticed a couple of colleagues popping their hands up while people were speaking. So if you've got a question, do take the time to put it in the Q&A box. And we've got about 15 minutes now for discussion. But thanks to all the speakers. And of course, I should also note to thank our funders, the Economic and Social Research Council. You saw that on the BR UK slides. So Richard, I think I'll start with the first question that was in the Q&A for you, because that came up while you were speaking. So what are the main, and I think you touched on this slightly, but maybe you could expand. What are the main barriers you experience to gathering new evidence you need at pace? Health security and health protection is an area where there are particularly rapid needs for evidence. So if you can comment on that, thanks.
Sure. So when I first saw that question, my mind immediately went to the classic more resource, more available budget, etc. But there's limited resource, there's limited capacity out there. We need to think about how we can actually do as much we can with what we have, whilst making the case for more. But I think for me, and I think it's come up in a couple of our presentations, is that one of the key barriers is when we're asked to contribute, and it's the fact that we're often, unfortunately, an afterthought. Oh, perhaps we should talk to the behavioural scientists about this, and very often the time compression as a result of that being an afterthought could result in a bit of tokenism or window dressing at best with the time that's available. So the message in my talk about trying to swim upstream to sort of earlier in the policy cycle, and as identified by Ash in that very helpful new US framework, there is a right place for us to enter into the discussions so that some of those barriers get removed, because we have the time and the space to be able to make as an effective contribution as we can.
Thank you, Richard. And I mean, from my perspective in government as well, I mentioned impact assessments at the beginning, which are often done under very tight timelines. Several of them have behavioural aspects. A Fairer Scotland duty for us springs to mind, which is all about inequalities. And if we're only asked at the end of the process to actually appraise those kinds of things, then there's very limited time for engagement or gathering of evidence. So I think that getting in there early on in the policy process and building those relationships across policy and analytical teams is absolutely key. And so the next question, and thanks, I think, to the colleague who posted this, I'll ask both Ben and Ash for their reflections. What are the best research methodologies to use to gather evidence? If we start with you, Ben, particularly if budgets are restricted, which, as you and I know, is very much the case at the moment, and it's difficult to collect robust evidence.
Yeah, thanks, Linda. So within the social research profession in government, we're regularly asked to gather evidence quickly on a given subject, which is a policy proposition. So we would use a lot of the teams that we have who have got links to the current issues and the expertise in that area, and it might lead to an evidence review internally, a desk-based bit of work, or alternatively we might commission something out. I guess it depends on a bunch of factors, but lots of the questions and things that we come to, I suppose they might be slightly asking a different take, or for a different kind of view, or a different policy proposition that we might not have come across before. But I think in most cases there would be a wealth of evidence around there that our first step would be to see what is already available and to use that material. Be interesting to see. I know that I've seen in some other presentations on behavioural science, people starting to look a little bit into artificial intelligence on this, and the ability that might have to synthesize evidence and to come up with things that could clearly work quite quickly and appropriately well, depending on how well it's used. But that's certainly something for the future that we'll be wanting to keep an eye on. But yeah, thanks.
Thanks, Ben. Ash, any thoughts from you?
Yeah, I think there's a build on what Ben is saying about the understanding what routine data are collected. And by that, I mean reference back to what I was talking about, not just the epidemiological data, but some of the harder data, what I call the vowels of internal decision-making, the attitudes, interests, emotions, opinions, understanding that the people that we are interested in have got. So an example of that would be the smoking toolkit survey, alcohol toolkit survey, regularly collected data that have got some of those harder data in. It's not just about the numbers, it's about some of that stuff. So look for those routine sources and understanding of those before we get there, before we get to the need. I think then the glib answer would be that it's tuned to the context that you're working in. So mixed method approach, what have we got in terms of, there's always a time, quality and resources triangle. How long have you got? How much money have you got? And what quality do you need? And if one of those is fixed, you haven't got much time, then you need an awful lot of money to get the quality up, or the quality is what it is. So that seems like a throwaway. And the other, just in terms of that mixed approach, we did some observational work during the pandemic. So lots of self-reported data on mask wearing and distancing. And as we were coming out of lockdown, with mass events, we looked to do some research by sending a team to look at people when they were in an event and try and cross-match the self-report of mask wearing and distancing with our observations sampled through how many people were doing that behavior. What happens when you play an audible warning out? That's an intervention from our perspective. You play that out. What happens? What was the response to the behavior? So there's a method of collection there. There was direct observation. So very much tune the collection method and the research to the opportunity that you've got, but time, quality, resources are always the fallback position. Hope that's helpful, Steve.
That's very helpful. So a couple of really interesting questions have come in, and I'm going to jump, I think, to the last one here, and then I'll come back to some of the others. And just anyone who wants to comment on this, maybe we'll start with Richard again. How can we evaluate, in essence, prove that policies that are informed by behavioural science are more effective than those that aren't? Now, you've given us the Leicester example, which I think is a very good one. But have you got any other examples, Richard, you want to share?
Yes, God. So, I mean, in terms of how we do it, I think there is a push across government to evaluate policy, whether it's the evaluation task force or government departments themselves developing evaluation teams. I know in UKHSA we have a new one that's going to help us to do exactly that. And I think it starts with actually identifying the components of a policy that have actually been influenced by behavioural science and behavioural scientists, and understand actually how those are interacting with other elements of the policy itself. And I think sometimes, like the example that sprung to mind, was another COVID example, and I think it's an example of the effective influence of the scientific advice that was coming through SPI-B, and it was around the support for and the imposition of legal restrictions around self-isolation. Now, I think a really good example of the influence in policy of behavioural science there was that the problem with imposing legal restrictions on anything really is that typically the threat of a fine doesn't actually make it easier to perform the behavior that we're trying to encourage. And we had developed an understanding of what it was that made self-isolation sort of hard or difficult. And so at the time at which that was that legislation was set out, we also saw the introduction of self-isolation support payments that were designed to address specifically an element of what made it hard for people to adhere. Now, that's a really good example, I think, of the influence of behavioural science in policy. But then we could have a longer conversation another time about the effectiveness of the implementation of that programme. In some areas, I think it did facilitate adherence to self-isolation. In others, there may have been some challenges around its implementation. So I think I mentioned that as an example of one of the areas where I think behavioural science has had influence and where efforts to evaluate that influence have taken place. I hope that's a useful example, if not a complete answer to the question.
It's an excellent example. I've got one I can mention, but Ben, Ashley, anything you want to reflect on there? No? Okay, Ashley? Ash?
No, Richard covered it, I think.
Yeah, I'm going to give a non-health example, and colleagues, those of you that know me, I know I've talked about this before, the Ukraine resettlement scheme, the super sponsor scheme for Ukrainians in Scotland, set up at an incredible pace. The need to actually engage with Ukrainians and understand what the barriers and facilitators were to the accommodation options, to their access to primary care, to English language, actually engaging with Ukrainians, involving behavioural researchers in some of that with translators very early on in the process was absolutely key to a successful programme, and it also informed the tricky actions my policy colleagues had to take to work with local government to then identify how we would support Ukrainians to integrate into different communities in Scotland where they were offered housing, perhaps not in the area that they originally arrived or wanted to necessarily to live in. So work with local communities receiving Ukrainians as well. Really, really important behavioural contributions to that work. So, and then I guess the other question I just wanted to pose, so this, I will just comment because we've only got a few minutes left, is a really excellent comment from a student in health psychology in the chat. So Q&A, if anybody wants to comment on that. Health psychology is a fantastic discipline to study, lots of opportunities in government, in behavioural research and the social research and analytical professions for people with a health psychology background, or indeed, if you're interested in finding out more about BRUK and our work and perhaps engaging with us, do drop an email to us. But great question. What's the best way to present evidence to policymakers? Ben, when you have to turn up an executive team, what do you do?
I think they want to get the message very quickly and be assured that it's sound and based on sound premises and things like that. So I think short to the point, like speaking to the world and to their question and things like that are always really important. I think one thing that is like long reports, detailed stuff like that is a bad way to do it. I think policymakers don't often have the time. Even if they had the desire, they wouldn't have the time to necessarily read it, and they probably don't spend a lot of time browsing. So it has to be a very bespoke communication. I remember I used to work in justice, and there was somebody at the Scottish Centre for Crime and Justice Research who used to phone me up every 3 months just for an updated organogram, and then they would get in contact with the policy leads, and they would know who everyone was, and it was that relationship, developing a relationship with the policymakers so that they could check in what's happening. And I think that was so powerful to have that recognition. To end up get invited to meetings, starting to help policymakers understand the questions and things like that. So I would think that that relationship thing is probably really a good idea, as well as the punchy visual, clear communications. But yeah.
Ash, any thoughts from you?
Yeah, I go along with that. In a word, it's about conversation. So I highlighted in my last slide about the proximity to the policymakers. That's the same stuff as Ben is talking about, the relationships. So you've got to be agile. You can respond. You can iterate as you go along. I think the use of the probability yardstick is really helpful in that space as well. It's really understanding them as a stakeholder. So what do they need to know? What do they think is normal for them to be doing? What do they believe is going to happen as a consequence of having behaviorally informed advice compared to non-behaviorally informed advice? So that all takes a little bit of time to build up. But then, yeah, it's TLDR, isn't it? Too long didn't read. Everything is running at such a pace, and people's bandwidth is fixed, that we've got to find a way to come up with nuggets of advice with clear rationale.
Yeah, I remember a meeting with the Cabinet Secretary who said to me, if you could just please give me 2 pages on the changes in this policy area, because I've been in so many different meetings with the analysts telling me what evidence is being gathered and analysed, but I just need it in one place. And that was very true. Richard, any brief answer from you, and then we'll conclude.
Yeah, sure. So my first thought is echoing something that Ben and Ash have said, which is that really the best way to communicate with policymakers is the way in which they are that they typically expect to see and receive evidence to inform policy. So how do they do it at the moment, and how can we fit in? Your brilliant research paper in a high impact journal is going to be of no use to them if they're working in sort of fast really kind of time-poor environments. And so how would they like to receive the information? And once you know that, you can start tailoring what you have and maybe build and improve on their processes if you think there's a better way of getting it across. I'll stop there.
Thank you, Richard. Well, thank you to all our speakers and to those of you that attended. I think that was a wide-ranging discussion covering lots of policy areas, emphasising the importance of behavioural research in government and also engaging with our academics and others in other sectors. Please do join us for our next Behavioural Research UK webinar, which is on the 22nd of November at 9:30. Another really interesting topic, public engagement in research and policy in relation to behavioural research. So thank you to everyone, and we'll sign off now.